iSARMs.com, the #1 place to learn about SARMs online.
And today I want to talk to you about Accutane. Now, a lot of people ask questions about Accutane, and I get a lot of video requests about it, so I just want to make sure that I kind of get the pertinent information out there, because cases of acne are obviously a big problem in the anabolic world, and so people are always looking for a remedy and solution, and a lot of people ask about Accutane. So basically, Accutane is primarily used to treat bad cases of acne, which most of you know, and that really and to help the skin more rapidly kind of renew itself in the process. So in addition to this, and in some very rare cases, it's used for certain skin cancers and different types of skin diseases, but that's in very, very rare occasions. It's a type of retinoid. I'm sure some of you that have been to the doctor for this issue have been prescribed retinoid in the past, and you kind of know how it works. That's naturally found in the body in small amounts as well. So many of you get a prescription for retinoid or retinol cream that have a bad case of acne from your dermatologist or a doctor, but generally your dermatologist. Accutane is a prescription drug. It actually is sold over the counter without a prescription in many countries, though, too. So there are some countries that can just walk right in and you can buy it. And in the U.S., it's a prescription drug. Now, bodybuilders that, like I said before, it can be a concern for, but the ones that have generally used anabolic steroids have really utilized Accutane to counteract the negative effects of steroids on their skin, especially when they have acne-related side effects. Now, what actually is acne, which I'm sure most of you know, but just to describe it for you, it's a chronic skin condition. It actually can manifest itself in like black and white heads, greasy skin, pimples. You've had them all. You know exactly what I'm talking about. I mean, it's all acne. Teenagers really that are going through hormonal changes may experience reduced self-esteem and anxiety really due to the effects of acne, because it does really hit teenagers hard. It's really most common during these years, and as androgen levels and testosterone levels are increasing, that's when you start to have an occurrence as well. 80% of the cases of acne are actually genetic cases, but there actually is some evidence that certain diet and lifestyle choices, especially like smoking cigarettes, for example, that's actually going to increase the severity of the condition 20-fold. Acne is really most common in certain like parts of the skin that have a lot of oil glands, like your face, your chest, your back. You'll notice those are the areas that get it. Those are the areas that have a lot of oil glands. So when natural treatments actually fail, Accutane is kind of like your last resort, kind of like with an aromatase inhibitor. Letroz is kind of like your last resort. You're just pulling out the biggest gun on the shelf. The Accutane is like that. It's like the biggest dog out there for the treatment of acne. How does it actually work, Accutane? Well, it works as an isomer of vitamin A. So what that does is it actually is going to reduce the amount of oil that's released by the oil glands, like we were talking about earlier, within the skin. And this is actually going to make it very, very difficult for any sort of acne to form at all. And it's going to reduce any existing acne a lot. Very, very significant amounts of reduction. So nearly all patients achieve clearing of acne during a course of Accutane. 90% of those results actually report excellent results with higher doses. Those that choose to dose low will have results with diminished side effects, though. But you're also going to run the risk of reoccurrence. So it's kind of like, what do I do here? It's a win-lose situation, I guess is what I'm saying. Now, since chances of acne are heavily increased with anabolic steroid use, bodybuilding requires looking good, obviously, especially when you're a physique competitor. So many athletes that kind of have had trouble really controlling and curing their acne with the natural remedy route, they're going to turn to Accutane. It's just common knowledge that it's prevalently talked about. It's like I said before, that androgenic increase that's associated with steroids, that's really going to trigger the increase in acne. And it's especially true for those that are genetically prone to the condition, like I had said. So, but the hormonal changes really trigger acne. when you increase your testosterone levels just rapidly, that's going to induce it, things of that nature. But we do need to talk about the side effects of Accutane too, because there are side effects there. High doses of Accutane can actually result in vitamin A toxicity, and that can result in some bad side effects, permanent and temporary ones. You could see stunted growth. I mean, really? Stunted growth? In 2010, the FDA put out there that the drug may stop bone growth in teenagers still growing. Not good. Not good at all. You could see some IBD, which is inflammatory bowel disease. And some studies have actually linked it to causing Crohn's disease too. You could have some eye changes. You could have decreased night vision and some dry eyes as well. There's been other issues, skin problems, hyperotosis, birth defects when pregnant women have taken them. They've all been reported. And psychological effects too, particularly depression. That seems to be quite common. It's not proven, but it's something that keeps coming up over and over again. So there's some serious stuff going on here. Do not go crazy on your dosing. Just don't do it. Don't think that more is better all the time, because you'll learn the hard way. When you're talking about a bodybuilder, the dosage should be conservative. A 1-a-day dose of like 10 to 20 milligrams for no more than 6 to 8 weeks. Max, and that should work just fine. That's all you need as a bodybuilder. The general public that's really fighting severe and real acne, you want to be more in the 50 to 150 milligram dosage per day, and it might be actually prescribed that way by a physician or doctor or dermatologist, whatever you're going to. It's a really good idea to take it with a large meal, and in addition, it may be necessary to actually use multiple courses of treatment. So that's Accutane for you. I really feel good about explaining this, because there's always a lot of questions on there, and it is a concern, and rightfully so. So I hope that I was able to help everybody with this and give you good guidance on the topic. So Dylan Gemelli, signing off.
iSARMs.com, the #1 place to learn about SARMs online.